Hey guys, in this video we will be talking about thrombocytes, that is platelets. I hope you've seen the previous video of RBC. The question which can be asked from this video is about the structure, properties or formation of thrombocytes, and then they can ask you mainly that is blood clotting, which is hemostasis. Don't worry, we will be covering each and every topic right now in the upcoming slides. So we start first with a little introduction. इनका ये जो पर्पल वाले तुम लोग देख रहे हो, these are the platelets. They are small and around 2 to 4 micrometers in diameter. They have no nucleus just like RBC. उनका speciality क्या है? That the cytoplasm is packed with granules which contain a variety of substances that promote blood clotting, which causes hemostasis. The normal blood platelet count is around 2 to 4 lakhs per cubic millimeter. The units is important. The number again is important. Different books will mention differently, but for your understanding purpose, 2.5 is the average lakhs per cubic millimeter. The lifespan of platelets is between 8 and 11 days, and those not used in hemostasis are destroyed by macrophages, mainly in spleen. यानी उसका destruction कहाँ पे होता है? तो spleen में होता है. Fine. The lifespan is around 8 to 10 days, which you can remember it as a week long, week से थोड़ा ज़्यादा. The production will again be in the bone marrow and destruction will be in spleen, like RBC. We come to platelet formation. ये similar diagram हम लोग ने RBC के erythropoiesis production में देखा था. तो I hope you've seen that video. If not, you can revise it because अभी I'll just brush it off. First, there are stem cell, जिसके पास ability होता है to differentiate into any specialized cell. Then they decide that I want to be a blood cell, but they've still not committed. So they are uncommitted, pluripotent, hemopoietic stem cell. Then they finally commit कि okay, I will become a certain type of blood cell. So they are called as committed, pluripotent, hemopoietic stem cell. Cells which are restricted to give rise to one form of blood cell. उसके पास दो ऑप्शन होते हैं. एक तो होता है कि वो लिम्फोइड सेल बने या तो कॉलोनी फॉर्मिंग ब्लास्टोसाइट बने. After being colony forming blastocyte again, he has three options, either to be a CFU-GM, CFU-E or CFU-M. In RBC, we talked about CFU-E, that is colony forming unit erythrocyte. Here we talk about CFU-M, that is colony forming unit megakaryocyte. Part of the cytoplasm is detached and it enters the circulation, which gives rise to platelets. सो मेगा कैरियोसाइट जो रहता है, हम लोग ने पीछे डायग्राम कैसा देखा, ऐसा ऐसा, या a part of the cytoplasm gets detached and it enters the circulation. This detached part is called the platelet. Okay, it could be like this, it could be like this, it could be in any way. The bigger cell, which the star-shaped cell जो भी बनाया, that is known as a megakaryocyte. और फिर उसके जो parts जो circulation में enter हो रहे हैं, those are known as platelets. Okay, I hope this is clear. Stem cell, uncommitted pluripotent hemopoietic stem cell, committed pluripotent, it is also known as CPHSC, then colony forming blastocyte, CFUM, megakaryocyte, and then ultimately platelets. Fine. Then we come to the applied part. Applied में main चीज जो दो तुम्हें compulsorily बात करना है about blood cells is decrease and increase. Decrease को बोलते हैं thrombocytopenia. Okay, penia is the word. Thrombocytopenia. Thrombocyte means our platelets, penia is decrease. So decrease in platelet counts, it is usually in some infection. मोस्ट कॉमनली अगर तुमको देखो तो डेंगू में होता है प्लेटलेट काउंट डिक्रीज, इवन मलेरिया में होता है प्लेटलेट काउंट डिक्रीज. फिर एनी स्प्लीन एनलार्जमेंट, क्योंकि उसका डिस्ट्रक्शन कहाँ हो रहा था, स्प्लीन में हो रहा था, तो spleen अगर enlarged है because of some reason, then it will perform its function excessively. Since it is going to excessively perform its function, there is going to be excessive destruction of thrombocytes, which is why its number will decrease. There is going to be thrombocytopenia. Coming next to thrombocytosis, that means increase in thrombocytes or increase in platelet counts. This will occur mainly in allergic condition, अगर कुछ allergy वगैरह हुआ. Hemorrhage, hemorrhage में क्यों होता है, we will see soon. And splenectomy, splenectomy यानी बॉडी से स्प्लीन निकाल देना. द आइडिया एंड द कंसेप्ट हम सिमिलर अप्लाई करेंगे कि अगर स्प्लीन को निकाल दिया तो डिस्ट्रक्शन होने के जगह को निकाल दिया, तो सर्कुलेशन में घूमता ही रहेगा प्लेटलेट और इसके वजह से उसका अपैरेंट काउंट विल इंक्रीज. फाइन. I hope this is clear. Then we move on to the next slide. We talk about mechanism of coagulation and hemostasis. It is one of the most important topic of this chapter, right? So why is coagulation? अभी हम लोग ने कभी भी coagulation as a layman सुना रहेगा तो we be like अरे बहुत खराब हुआ, इसका blood clot हो रहा है and so, right? But coagulation in fact is very important process. You know why? Because if your blood vessel is damaged, for example if you nick your knee और कुछ भी तुमको injury हुआ, अगर तुम्हारा coagulation mechanism disturbed है तो वो ब्लड रोक ही नहीं पाओगे तुम, वो कंटिन्यूसली जाता ही रहेगा इन द एक्सटर्नल एनवायरनमेंट. I'll give you a general knowledge thought. जो इंग्लैंड के प्रिंस एंड ऑल है, they have a trait in which they have deficiency of a certain factor required for coagulation, which is why if they bleed, उनको थोड़ा भी इंजरी हुआ, so there is a chance that they will bleed out. मतलब बॉडी का जितना भी ब्लड है सब कुछ वो वूंड से निकल जाएगा. तो एक्सप्लेन यू इन सिंपलर टर्म्स कि अगर तुमको कभी कुछ लगता है तो फिर थोड़े टाइम में, like in less than 1 or 2 minutes, your blood stops flowing. You apply some pressure, even if you don't apply pressure, if it's a small wound, it will stop bleeding. It will not bleed for an infinite time. But जो उधर के प्रिंस लोग हैं ना, उन लोग को ऐसा डिफेक्ट है, which is why they have to be more careful and they have a medical treatment. Okay, not going into that, let's start with mechanism of coagulation. When a blood vessel is damaged, loss of blood is stopped and healing occurs in a series of overlapping processes in which platelets play a vital part. The more badly damaged the vessel wall is, the faster coagulation begins, sometimes as quickly as 15 seconds after injury. This is how quickly it begins, right? Now we go on to steps of coagulation. There are like 3 to 4 steps, three mainly. You have to remember them in the exact order because they occur in the exact order. The first one is vasoconstriction, which we will see here. वेजो मतलब हमारा ब्लड वेसल से रिलेटेड होता है एंड कंस्ट्रिक्शन मतलब तुमको पता होगा टू कंस्ट्रिक्ट, दैट इज डिक्रीज इन साइज. सो इफ दिस इज अ नॉर्मल ब्लड वेसल और यहाँ पे इंजरी हुआ है, यहाँ पे थोड़ा प्रॉब्लम है, सो on and around that area it will be vasoconstricted. You see this thing is vasoconstriction. How does that happen? Whenever there is an injury, which you can see in this diagram, the vessel wall is going to release a certain hormones which are like thromboxins, जो कंस्ट्रक्शन में हेल्प करेगा. अलॉन्ग विद दैट ये जगह पे जहाँ पे इंजरी हुआ वहाँ पे प्लेटलेट्स आएगा क्योंकि उसका काम है इंजरी को रोकना, ब्लड को बाहर जाना रोकना. और फिर अल्टीमेटली दे विल ऑल्सो रिलीज अ सर्टेन थिंग विच इज सेरोटोनिन, which constricts the blood vessel, reducing the stoppage of blood flow through it. What we do it, अगर मैं तुमको एग्जाम्पल दूँ, if you are watering your plants and there is the pipe, उसके पाइप को तुम बीच में से वेजो कंस्ट्रिक्ट यानी बीच में से कंस्ट्रिक्ट करोगे, या there is a what we call a nick, like if I'll draw here, one second, I think this is easy to understand, but still, if this is the pipe, अगर ये ऐसे नॉर्मल रहा तो आता रहेगा पानी अच्छे से, but if at some place it is nicked like this, once here, so yeah, तो ये जो हुआ ये वेजो कंस्ट्रिक्शन हुआ, तो तुमको ऑटोमेटिकली समझेगा ना कि पानी का आउटफ्लो जो बाहर आ रहा था, इन दिस प्रोसेस इट वाज मोर, और यहाँ पे कम हो जाएगा. So blood flow outside the body or blood loss will decrease by this preliminary action of vasoconstriction. This is the first step, which is vasoconstriction. Now we go on to the next one, which is platelet plug formation. Yeah, you can see here the vasoconstriction, spasm वाला. अभी platelet plug formation में क्या होगा कि जिस जगह इंजरी हुआ है वहां पे platelets आके जमा होगा. You can see here the adherent platelets, they stick, first of all they stick to the vessel wall and they clump to each other. एक दूसरे के साथ भी bond करेगा. एक जन चिपका, फिर उसके ऊपर दूसरा, फिर दूसरा, दूसरा, and in fact they will also call other friends कि listen, we need help, come here, come here, come here. That whole process takes place and there is a plug formation. You can see एक plug जैसा बन गया है. Yeah, how do you write it? I'll just read it out to you. The adherent platelets clump up to each other and release some substances, including ADP, which attract more platelets to the sites. Yeah, you see more platelets have come up. Passing platelets stick to those already at the damaged vessel and they too release their chemicals. मतलब पहले तीन आए साइट पे, वो लोग चिपके and they like, oh come on, I need to call my friends. They called other friends through ADP. ADP is like उनका phone network. उससे वो लोग ने बुलाया और पांच आए. And those five stuck to the previous ones. Those previous ones stuck to the vessel wall. Then the newer five will also call the other five, and then other five, and then other five. So this is known as positive feedback mechanism. Yeah, I hope you remember positive feedback. We've covered it in hemostasis, I guess. Positive and negative feedback. Positive feedback is seen very less in the body. One of the important place where it is seen is in the coagulation, and then second is in childbirth. So yeah, please revise that as well. But like I said, पाँच आए, पाँच पाँच को बुलाइए, पाँच पाँच को बुलाइए, पाँच पाँच को बुलाइए. That is the positive feedback mechanism by which many platelets rapidly arrive at the site of vascular damage and quickly form a temporary seal. This seal is known as the platelet plug. The word to remember is कि ये temporary है, permanently उधर नहीं रहेगा, temporary है. Platelet plug formation is usually complete within 6 minutes of injury. Okay, this was our second step. First step was vasoconstriction, second is platelet plug formation. Going to the third step, which is coagulation of blood. Okay, coagulation of blood is defined as the process in which blood loses its fluidity and becomes jelly-like mass. I hope you can imagine this. Jelly वगैरह टीवी में देखा होगा या खाया होगा, कैसा दिखता है? Just a dark red shade of strawberry. Yeah, so it's like clumps like this. Fine. So that process where there is conversion of liquid blood into such thing is known as coagulation. ये प्रोसेस कैसे होएगा, उसका बहुत बड़ा mechanism है. There is a big cascade which is involved in it, but apparently in your books it is not mentioned in much depth, so I will be giving you an overview. Main thing that you have to remember is कि fibrinogen, fibrin, ये सब इसमें involved होएंगे. Okay, so let's see how it happens. During this process, fibrinogen is converted into fibrin. Fibrinogen किधर सुना है तुम लोग ने? It is a plasma protein, right? Albumin or globulin के साथ, so it is continuously in the plasma. That fibrinogen gets converted into fibrin. जो फाइब्रिन है, नाम से कैसा लग रहा है कि थ्रेड लाइक होगा, फाइबर्स, जूट फाइबर्स या अपने फ्रूट के फाइबर्स, और ऑल आर लाइक दिस थ्रेड लाइक. बनाना के फाइबर्स तुम लोग को पता रहेगा. सो फाइब्रिन in itself is a डोरी जैसा substance that will get attached to the loose platelet plug which blocks the ruptured part of the blood vessel and prevents further loss. अभी तक हम लोग ने क्या देखा कि ये ब्लड वेसल है, यहाँ पे सब प्लेटलेट्स आके अपना प्रोटेक्शन कर रहे जितना भी होगा, बट वी ऑल नो कि प्लेटलेट्स इन इटसेल्फ ज्यादा नहीं रोक पाएंगे, उसको कुछ एक्स्ट्रा एडिशनल प्रेशर चाहिए. दैट एडिशनल प्रेशर इज प्रोवाइडेड बाय दिस फाइब्रिन जो ऐसा मेश बनाएगा उधर. ओके, दिस इज द मेश. फाइन. This is the function of fibrin. This ends are 3 steps. ये fibrinogen और fibrin ये सब के production के बीच में भी there are multiple steps which we've not seen yet. But this is the छोटा diagram for you to remember all the 3 steps. So let's do a recap. First, there is injury to blood vessel and damage of endothelium that causes exposure of collagen. So platelets start getting adherent to collagen. वो दूसरे platelets को बुलाएगा और एक्टिवेशन होगा. फर्स्ट थिंग दैट इट विल डू इज सिक्रीट सेरोटोनिन जो वेजोकंस्ट्रिक्शन करेगा. Right, first step. Second, it will secrete ADP and thromboxane, which will cause other platelets to come in, and thus it will form a platelet plug. Third thing is formation of prothrombin activators. There are multiple steps. Ultimately, उसका end result है कि हमको fibrin मिलेगा. Fibrinogen is converted to fibrin, and the blood is clotting. These are the 3 stages, and we move on to the next slide. The last step is fibrinolysis. ओके, नाम से क्या समझ रहा है कि फाइब्रिन का लाइसिस, लाइसिस यानी ब्रेक डाउन होगा, राइट. इफ यू रिमेम्बर देयर वाज वन वर्ड विच वी कॉल्ड इट कि ये टेम्पररी होता है पूरा प्लेटलेट प्लग और सब कुछ. सो दिस हैज टू एंड नो समवेयर, सो दैट एंड्स इन द फोर्थ स्टेप. When after the blood clot is formed, the process of removing it and healing the damaged blood vessel begins. The breakdown of the clot or fibrinolysis is the first stage of healing. कैसे होगा? तो इसमें ये तुम देख रहे हो प्लाज्मिनोजन एक्टिवेटर है, that gets trapped within the clot and that will convert plasminogen into plasmin. You can see, so it is like a catalyst. It will convert plasminogen into plasmin. This plasmin again acts as a catalyst, and जो अपना फाइब्रिन अपन ने इतना फाइब्रिनोजन कन्वर्ट करके फाइब्रिन बनाया था उसको तोड़ देगी इनटू फाइब्रिन डिग्रेडेड प्रोडक्ट्स. तो अपना फाइब्रिन ऐसा था, समवॉट लाइक दिस, उसको ऐसा 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 कर देगी, फाइब्रिन डिग्रेडेड प्रोडक्ट्स. ओके, आई होप दिस इज क्लियर. Plasmin breaks down fibrin into soluble products that are treated as waste material and removed by phagocytes. Phagocytes यानी हमारे WBCs, the neutrophils and macrophages, mainly macrophages. As the clot is removed, the healing process restores the integrity of the blood vessel wall. So that is it for this video. We saw about introduction and properties of platelets. हम लोग ने उसका platelet formation देखा, thrombocytosis, thrombocytopenia के बारे में पढ़ा, and then we went on to hemostasis. Hemostasis has 3 main processes, that is vasoconstriction, platelet plug formation, and blood coagulation. And then there is fourth process which is fibrinolysis, जिसमें हम लोग ने अभी तक जो भी किया 3 स्टेप में उसका ब्रेक डाउन होगा and the vessel will get time to heal on its own. In the previous slides, that is fibrinogen to fibrin conversion, there is a big cascade. If important, you can do it. If not, you can skip it. Yeah, so that is it for this video. I hope you've enjoyed it. Thank you.